Welcome back to San Antonio Living. Well, it's Tuesday, and that means we're visiting our friends over at the Institute for Women's Health. If you happen to be feeling some pain in your pelvic area, it could mean many things, but we're breaking it down in today's Girl Talk. Take a look.
You need to head over to the gynecologist at least once a year for a checkup. But luckily for us, we're talking to Dr. Alejandro Treszezamsky, and he is a urogynecologist. Thanks for talking to us.
Thank you.
What is a urogynecologist?
A urogynecologist is a gynecologist who, after finishing training in gynecology, has decided to specialize in this field called urogynecology, or female pelvic floor medicine and reconstructive surgery. So it's a specialist who focuses on the problems or disorders of the pelvic floor. The pelvic floor is a set of muscles, ligaments, and the connective tissue that holds the organs in the pelvis. These organs in women include the rectum, the uterus, the vagina, and the bladder.
Okay.
So when the pelvic floor over time weakens and stretches, it can cause displacement of these organs and alterations in how these organs function.
Now, is that going to happen to everybody?
No, it won't happen to everybody, but it's a fairly common problem. And the main risk factors are age, that is becoming older, having had children, and body weight.
Okay.
So it's a fairly common problem. A lot of women, either they don't know there's a specialist who can treat this problem, or they are embarrassed to talk about them, because some of the symptoms that these pelvic floor problems can cause is, for example, incontinence of urine, so loss of bladder control, and also loss of bowel control.
What are some of the most common symptoms, and how do you guys treat these symptoms?
Well, there are several problems. So one of the most common symptoms is leakage of urine, and there's different types of leakage of urine. For example, a typical problem is called stress urine incontinence. It's not mental stress, although it can cause it, but it's stress on the bladder. So when women coughs or sneezes or lifts something heavy or bends or exercises,
Something might happen you don't want to happen.
So there can be a little bit of urine leakage, or a lot. Some other women have other type of bladder problems, which is having the need to go to the bathroom very frequently, like every 15 minutes or 30 minutes. Even when the bladder is not full, the bladder is like sending signals to the brain saying, I need to go, I need to go, I need to go. And women may need to even wake up at night to go to the bathroom. And sometimes the urge is so much that they don't have time to make it to the bathroom, and then they have incontinence. There's also bowel control problems, where there's either very severe constipation, so women can't empty the rectum well, or they have leakage of stool.
All right, it's the Institute for Women's Health. They are on Floyd Curl, Suite 900. You can give them a call at 614-1000. Check them out online, ifwh.org. Find them on Facebook, Institute for Women's Health, or on Twitter at IFWHSA. All right, everybody.